start. Very good morning. Today I am going to demonstrate how to set up and how to use a T-piece resuscitator which we have recently got in our labor room. First of all, doing a hand wash, proper hand wash as per WHO recommendations, and doing it in an aseptic precautions, taking all the steps for aseptic procedure. This is our T-piece resuscitator which we have recently got. First of all, we'd like to understand the various knobs and the various parts of this T-piece resuscitator. This is a manometer which shows us the various pressures which are for the positive inspiratory pressure as well as the positive and expiratory pressure, which we'll demonstrate while we are setting this T-piece resuscitator. This is the gas inlet, the source of which is from an oxygen blender, because blender is very important for resuscitating a newborn baby. This is the gas outlet which is connected to the limb which we give to the baby. Here is the knob which is for the maximum pressure, which is also known as maximum pressure relief. This is the PIP knob which gives us the inspiratory pressure, and for setting up the PEEP there is a small knob at the head of this white cap. This is for setting a PEEP. Now it comes with different sizes of mask which we use according to the gestation of the baby as per the weight of the baby. This is the test lung which we have got along with the T-piece resuscitator. Now starting up how to set up this thing. I have set up this oxygen inlet with this oxygen blender. With this I will set up, suppose this is a term baby, I will set it at 21%, and if this is a preterm baby less than 35 weeks, then we usually set it at 30 weeks for resuscitation. Now once we have set this thing, we'll start with the flow of the gas which is required. Usually it is kept between 5 to 15 and we usually keep it at about 9 to 10. So this bubbling is showing that we have maintained a flow which is now coming to this machine. Now to set up all these parameters, how we'll do this, we'll attach a test lung to this thing, right? First of all, we will set this maximum pressure. So how we'll do it, we keep this thing occluded here and we move this knob clockwise up to the maximum level. So this is the maximum pressure which we'll get, and the pressure will not go beyond this. Now for setting PIP, we'll move it anti-clockwise to a level which we want to keep. Suppose we want to keep a pressure of 20 centimeter for positive inspiratory pressure. We will set it at 20. You can see here we are setting it at 20. So when we'll give the breath to the baby, the PIP will be 20 centimeters. And now for adjusting the PEEP, we will move this to keep a PEEP of 5 centimeters, right? Now to see how the resuscitation goes in a baby, this appropriately sized mask, and we'll create a C and E with making a tight seal so that the air is not leaked from this side, and with this hand we give the pressure. So this is breathe 2 3, 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 breathe 2 3. You can see the chest rise which is occurring. So this breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3. We give in a fashion so that it maintains a respiratory rate of 40 to 60 per minute. Breathe 2 3, breathe 2 3, breathe 2 3, breathe 2 3. The advantages of T-piece resuscitator over the bag and mask ventilation is that it helps in regulating our pressure, that is the PIP, and it along with PIP it also gives PEEP. So we can maintain a PEEP of 5 centimeter, which is not possible with a bag and mask. So now it's said that even 4 to 5 breaths which we give with a bag and mask ventilation are enough to cause a permanent damage to the alveoli, which can lead to bronchopulmonary dysplasia or chronic lung disease in a newborn. So it's the need of the hour that we should be using T-piece resuscitator in our labor room along with oxygen blender. Thank you.